2 1 2. Si jalle sinjenne, si jippe hinjenne, si jalle sinjenne, mali amrin tuni, nafi miya jalle, si jippe hinjenne, si jalle sinjenne, mali amrin tuni, nafi miya jalle, tus nigerta. Magara jabata, uton agartu, kanisi waywatu, nartus nigarta wayway. Magara jabata, uton agartu, kanisi waywatu. Tutia, ibsitanati, gammachun tanto, natay sumati, malana dawi, jajabatanati, ibsitutia, ibsitanati, gammachun tanto, natay sumati. Malana dawi jajabatanati altus nigerta magara jabata uton agartu kanisi waywatu altus nigerta way magara jabata lubuton agartu kanisi waywatu. Thank you.
Good afternoon. The other day, I was reading a quote from a person known as Mel Robbins. Your mental health is everything. Prioritize it. Make the time like your life depends on it, because it does. That's what it says. I'm sure your deliberations were wonderful and effective and successful. And I'm glad to be back again to stand in front of you, in front of these all scholars from different corners of the world. And those of you from other parts of the world, once again, welcome to Ethiopia, the land of origins, the birthplace of coffee Arabica. His Excellency Dr. Fayyaa Kababo, Deputy Head of Oromiyaa Health Bureau and Wing Head of Public Health Emergency Management, Health Research and Laboratory Service, who is also guest of honor of this very closing event. His Excellency Dr. Malkamu Abite, Deputy Director General of the Ethiopian Public Health Institute, Her Excellency Lili Marcos Birra, Founder and Board Chairperson of Ali Birra Foundation, honorable leaders and employees of Oromiyaa Health Bureau, honorable participants, researchers, facilitators, honorable leaders from various levels, distinguished guests, excellencies, ladies and gentlemen, all protocols observed. Welcome to the closing event of the 3rd Annual International Health Research Conference, organized by Oromiyaa Health Bureau in collaboration with Ali Birra Foundation here in the capital at the Skylight Hotel. Once again, Nkwandana Matachu Anadufu Baganagan Duftan, welcome. I would like to directly invite Mr. Qo'annoo from Oromiyaa Health Bureau for summary of presentations that he would present. Put your hands together for him, please. Qo'annoo, come to the podium. Thank you.
Thank you very much, the chairpersons. I'm going to present you some of the key summary findings that is going to be present in the last 2 days. So, baga nagaan dhuftanii, baga gammaddanii, baga guyyaa irraa geessanii. Today is, the Mental Health Day as a world. Happy Mental Health Day. Yeah. So, namni fayyaa ta'e har'a ga'uunsaa utuu sammuun keenya nagaan taane ta'e iddoo kana dhufuu hin dandeenye waan ta'eef baga gammaddan isin jechuun barbaada. Jirtu? Jirtu? Eessa jirtu? Yeah, kunis seenaa ture. Yeah, baay'ee galatooma. So, I just going to present the summary of the findings, which is presented being the last 2 days. As you know, the mental health team is going to present with a grand theme, enhancing mental health care equity, the next frontier in the universal health coverage, with a few thematic areas like, mental health systems, the current universal health service coverage, and community-driven solutions, and the co-creation from the mental health, and the integrated mental health, and the physical health care, adolescent health and addictions, women's and the mental health challenges. These are the few points that is going to be presented the last few days. So the other thing is psychosocial and the mental health in crisis setting, especially in the IDP setting, and also the digital technologies, for mental health services is some of the few research findings being presented in the last 2 days. Yeah. So yesterday, the objective of the presentations was being presented by Dr. Fayyaa Kababo, and he highlights some of the key points on mental health services, especially mental health, particularly in Ethiopia, is somewhat overlooked, and make mental health accessible. As you know, the accessibility problem is, somewhat in that some part of the areas, the health service for mental health is not well accessible. So they call for accessible service, equitable and integratable health system, especially for the mental health service. And they also highlight make mental health explore community-driven solutions. Even there are many solutions which may be helps for the mental health problem in our society. So they highlight the importance of the community-driven solutions and integrating mental health with integrating the mental health care service. The other thing is the movement of collaborations, the importance of collaborations. Collaboration is very important in tackling the mental health challenges. And the compassion and the commitment is the point is being raised in the objective sessions by Dr. Tisfai, and that finally they call for the tangible to actions. They call for actions even for evidence, the accessibilities, the community-driven solutions, and they finally call for actions. The other thing raised in the yesterday session is on welcoming speech raised by Professor Natsanet, and she highlights mental health is often viewed as the spiritual rather than the medical care. In most part of our communities is taken as the spiritual case rather than the medical issues, and the other also highlights no one is free of mental health. Everybody has some part of some problem with associated with the mental health, as highlighted. The other thing is they also raised the shortage of the manpowers, the health workforce for healthcare versus especially focusing on the mental health, like the psychiatrists and specialists working on the nurses, and also the health extension workers. As the challenges is, there is a problem in these areas. Also, mental health, can be prevented and treated, and it's also become rehabilitated. The other thing, prevention of mental illness can be promoted through health lifestyles, like strong social support and positive child rearing practice. These are some of the points raised by Professor Nazanet, and the securing political commitment, strengthening research, fostering shared responsibilities are the few points raised during the welcome speech by the Professor Nazanet. So the other things noted by the keynote speakers, Professor Mustafa Albasi, they highlighted the support of research in collecting data to generate evidence-based actions, especially for mental health, and improve the mental health of individuals, communities, and the society through the resilient integration, collaboration, and optimism. And joining commitment is very important in enhancing the mental health services. And the other thing that I highlight is achieving progress improvement in mental health through the capacity building for the health professionals, open dialogue, and shared commitment is the point being raised by the Professor Mustafa. These are very important, critical in mental health service. The other thing raised by Honorary Obobadula Gamada, the founder of the Diboa Foundation, the highlight that mental health issue is no one has enough knowledge, especially on mental health service, by raising their experience, the lived experience of their own. So there is no well-established curriculum to educate even about the mental health service in our education system as well. And in the ministries, there is limited data related with the mental health services widely in Ethiopia. So they directly noted call for overall survey regarding with the mental health service data as well as the prevalence. The other thing is many children are affected by mental health conditions, yet the issues remains widely unrecognized as raised before. The other thing is addressing mental health issue requires strong leadership and active involvement, particularly the researchers, the policymakers, as well as the service deliverer or the service providers, as well as the community as well. So they need the integrated approach they need integrated approach to tackle the challenges related with the mental health. The other keynote speakers, Dr. Medin Salamo, the WHO representative, she raised, mental health is not a privilege, it's a matter of universal right for human being. And also she reflects about the overall well-being of the communities. Mental health is the foundation, and it is the core for the overall well-being of an individual. The other thing is universal health coverage cannot be achieved without ensuring the access to the mental health care service. Without mental health care service, we cannot achieve the overall well-being, the accessibility, as well as the health service delivery in other wings. The other thing is mental health is a matter of development. Mental health is not different from the development. So she raised that mental health is, it's parallel with the development of the countries. If we work on mental health, it's working as, indicates that as working as similar to the development of the nations. And the other thing she raised is, about the mental health, it should be integrated to emergency preparedness response plan, especially in the humanitarian setting, where there is a crisis in some parts of our countries and in the region as well. So the other problem she raised is, mental health problems that are often exacerbated by the natural and man-made disasters as raised. There is a conflict. If there is a conflict between somewhere, there may be aggravation factors for the occurrence of the mental health problem. And if there is a fueling somewhere, it may be aggravates the mental health problem. The other thing she raised, mental health service must be expanded to reach the vulnerable populations like the IDP and the refugee conflicts areas, even the marginalized populations like prisons and somewhat. So the mental health should be integrated to those services. The other point raised by Dr. Garramu, Luca, is Oromiyaa State University President. He highlights mental health is deeply rooted in social, cultural, and the political issues. It's not only a single thing, it's integrated in social as well as the cultural and the political issue. And also the strong and responsive system is needed to ensure the mental health and the well-being, and they call for 3 pillars, like access to inclusion for the mental health, and also they call for intervention to structural transformation, especially our structures should enhance the mental health service, and also they raised the evidence to ethics accountabilities. So there are call for these 3 points. So mental health equity is not a box to check. It is a long-term commitment, listening to learn, to redesign our system, our health system. So they raised these points. And also another keynote speaker is Dr. Masai from EPHI, he's Director General. And they raised tackling public health threats through evidence practice is very important. We have to have an evidence to tackle the challenges posed with the mental health problem. The other thing raised by Dr. Masai is during public health emergency, coordinate humanitarian assistance and contribute to the psychosocial support, and the mental health care service is very important, as raised by Dr. Masai. And also they raised strength and capacity building and the public health nutrition to promote the mental health and the well-being. This some of the points raised by Professor Dr. Masai. The other thing is the keynote speaker raised by Professor Afwork, the AHARI Director General. We catch few points to answer the point is to enhance mental health equity service, call for all large for complexity of human mental health problem, and mental health challenge are emerging issues affecting the equity as well as the accessibility of even the Ethiopians as well than the sub-Saharan African and African countries, including Ethiopia. And also they raised a few questions. How can we address mental health challenges through research and innovation? So they raised a very important questions, especially which is used for research, especially in the higher education institutions. and as the researchers, how can we address the mental health challenges through the research and innovations and new ideas. The other thing they raised was how can we ensure the research and innovation to translate into the practical solution. We are doing research here and there, but if it left on the shelf, sometimes it's very difficult, it's very common. So they raised how can we translate such type of evidence, how can we distribute, how can we absorb such type of evidence generated in here and there, especially in higher education institutions as well as other research institutes. And also they call for ensure the most vulnerable populations, including those with mental health issues, benefit from the evidence and the knowledge generated from this conference output and beyond. They raised 6 points, and we also take an assignment to solve these important questions. And they finally put that to ensure no one left behind, we have to put the mental health as a core for our service, especially in our health services. Yeah, the keynote speakers noted by Mr. Lily Birra, the founder of the Ali Birra Foundation, she raised that, some part of mental health is somewhat overlooked and misunderstood by our community. So this should be solved with research and as well by the involvement of Bagadas as well as Harasingers and the community leaders. The other thing is mental health service should be accessible as well as should be compassionate and respect to the dignity of an individual for everybody. So they read very important points. Finally, at the opening speech, Her Excellency Dr. Meik Deslaba, the Minister of Health, raised very important points related with the mental health. She raised that mental health is the foundation for everything. Mental health is, the foundation for even the other health services. Without brain, we cannot do anything. For example, if our health workers, they have mental health problems, like if they have working stress, it's possible to achieve our universal health service coverage as well. So I think it is the foundation for all health services. And they also raised stability families. The mental health is more of comprehensive. It's not a single thing. It's the matter of communities as well as the matter of the families. And also they raised mental health can be alleviated through social support and the community interactions like, ECOP, EDIR. They raised also the role of the Bagadas and the Harasingers in addition to the clinical service that we have giving in our hospital. And the other thing is, they raised, innovation, digitalizing, capacity building are essential for advancing the mental health services. Innovation, digitalization, the core for providing the mental health service. And finally, they call for actions to make mental health services accessible and equitable at all levels, including the catastrophic situations wherever there is IDP or the humanitarian setting. The mental health should be one of the core competencies. The other important sessions that have been done yesterday is the panel discussions. These are the panelists and the moderator is Professor Atalay, and the theme is under current mental health care service, state in Ethiopia's challenges and the opportunities. These are the points being raised. A few points was catched in this session. The point which is raised is the stigma towards the women mental health services. So these are one of the points. The challenges related with the stigma. Mental health service shall be advocated at all levels, not only at the government level only, it should be advocated at community level as well. The government level is also included in the policy part. So mental health service users' voice shall be included in all activities related to mental health. We have to raise our voice, we have to loud our voice related with the women's mental health challenge. They raised during the panel discussion. The other thing is raised is women mental health is not only about medical service. it is a matter of the equity and the dignity of the human right. They also raise these points. This is very important. The prevalence of substance use disorder in Ethiopia is getting high, with the young age group getting involved more. And the other point is substance use disorder through demand and supply actions of this substance, reductions of this substance, dedicated institutions for substance use disorders. Management should be accessible and decentralized from the higher level to the lower level. The other point raised during the panel discussion is mental health stigma is a major bottleneck in service provision as well. And the other point is we have to tackle the stigma related with the people with the mental health. These are some of the points being raised during the panel discussions. These are the overall research findings. There are 19 oral presentations and 9 poster presentations being presented in the last 2 days, focusing on the grand theme, enhancing mental health and equity, the next frontier in universal health service. These are a few PowerPoint, the oral presentations cut during the sessions. I didn't go through all of the presentation due to the time constraints. These are one of the psychological disorders and the associated factors among the DM individuals, the diabetic mellitus. And the other point raised is, magnitude of suicidal ideations, attempt, and the associated factors among the HIV populations. These are the research being presented. The point was included in the final points. Horabula, Fayyaa Devada.
The term Horabula defines many things. It's about health, about well-being, including mental health, about togetherness, about peace, about unity. Horabula, that is how we thank people in Afan Oromo. Thank you so much, everybody. And put your hands together for Qo'annoo once again. Now we're moving to recognize people who made this conference successful. So we're about to conclude it, close it. But your networking, I'm sure, can do more, because these researches would not be only for shared purpose. I know you're doing well for the success of the society. Thank you so much indeed. And I would like to call to the podium Gammachuu Shumee from Oromiyaa Health Bureau and Sister Saada together here onto the podium, so that we would start giving certificates for individuals. Thank you so much. And joining us would be His Excellency Dr. Mlakamu Abite, Deputy Director General of the Ethiopian Public Health Institute. Put your hands together for him. A round of applause for him, please. Yesterday, Dr. Masal Hailu, head of the institute, was here. Today, the deputy is here. Thank you. And I call recipients of the certificates. First, Dr. Yasin Mohammed. Dr. Yasin Mohammed. Because he is one of the presenters. Mr. Abebe Dukesa Dukbiwak. Mr. Andwalam Derresa. Mr. Burhan Ordofa. Mr. Makonnen Sahai. Oh, you tired? Yeah, a round of applause for these guys, because they presented good things on this very topic. Thank you. Thank you. Mr. Zakir Abdu. Mr. Zakir Abdu. Mr. Adisalam Worke Demsash. Dr. Banti Galata Buli. Mr. Galata Anenko Dube. Mr. Getachew Kebede Hailu. Mr. Tashoma Guta. Mr. Solomon Seife Alamu. Mr. Yalo Naba. Mr. Hirbaye Mokona. Mr. Shaggai Shumet. Mr. Nagasa Didda. Professor Zode Brahanu. Mr. Shimelis Girma. Dr. Gary Hunduma. Dr. Haptamu McConan. Mr. Fulla'a Atomsa. Mr. Fulla'a Atomsa Gaddafa. Dr. Daraja Chara Dirriba. Mr. Bashir Mamiyo. Mr. Ababa Tolera Dirriba. Mr. Ahmed Jabal. And Mr. Emmanuel Adunya. Congratulations for that recognition that you got. Thank you. Dr. Malkamu Galatoma. Boda garu garu waltajiti sindebisu kiyonolu. Wada zima malase ya karabna. Lahunu ndehedu kabir ta'iqalhoy. Ahun dagmo, I would like to call upon Sister Tigist Tafari, Deputy Head of Oromiyaa Health Bureau, to join us here on the podium. Women leaders are always important. Yeah, put your hands together, please. A round of applause. Should hand over certificate to panelists who were on this very stage yesterday. Professor Solomon Tefera. Professor Solomon. Let me move. Dr. David Asafa. Mrs. Eleni Musgano. Dr. Alison Johansson. Dr. Alison Johansson. Next, Dr. Naomi Abdurrahman. Dr. Horace Sidiso. Mr. Zagaye Yohannes. Mr. Zagaye Yohannes. Dr. Birrat Aha. Dr. Birrat Aha. Professor Talaka Azala. Professor. Mrs. Agitu Tadessa. Mrs. Agitu Tadessa. And finally, Dr. Lulu Benya. No, with Dr. Lulu Bakana, I'm sorry. If he's not around, thank you so much, Sister Tigist Tafari, Deputy Head of Oromiyaa Health Bureau. Put your hands together once again for Sister Tigist. That I always say, if you educate a man, you educate only one person. If you educate a woman, you educate the whole family. That's what Mahatma Gandhi said. Now me. All right, let's move. Let's move to the third and the final part of this very award. And I would ask His Excellency Dr. Tasfaya Kabobo, Deputy Head of Oromiyaa Health Bureau, to join us now on this very podium. And this topic is relevant to Dr. Tasfaya. That's why the research thing, and that's why he is for. And the first recipient of this certificate will be Professor Atalay Alam. Professor Atalay Alam, the facilitator, the moderator of yesterday. And that's it. Even in his absence, we recognize Dr. Adam Ismail. Dr. Adam Ismail. Dr. Melissa Neguse. Dr. Melissa Neguse. Dr. Abdi Bulcha. Dr. Abdi Bulcha. Mr. Ephraim Manekul. Mr. Ephraim Manekul. Dr. Eshetu Ejeta. Dr. Eshetu Ejeta. Dr. Zainabu Benya. Dr. Zainabu Benya. A tone a little bit higher for educated women. That's why. A round of applause, please. Mr. Abassa Gobena. Dr. Abdi Bacha, not Bulcha. In journalism, one of the crimes is missing names. So, thank you. Thank you. Mr. Burhanuk Anate from Oromiyaa Health Bureau, the presenter, the summit presenter. Mr. Gaetan Fatansa. Mr. Gaetan Fatansa. Miss Firmaye Bogale. Miss Firmaye Bogale. Dure Firmaye Bogale. Not around. We move on to individuals who were on public lecture. And Dr. Abdurrahman Rone. Dr. Jane Marie. Dr. Jane Marie. Dr. Mustafa Alafsi. Dr. Adil Katabai. Dr. Adil Katabai. Dr. Chai Law. Dr. Chai Law. Dr. Naomi Abdurrahman. Dr. Birra Taha. And finally, Dr. Alison Johnson. And Professor Afork Tamuru, of course, is the final recipient of the certificate here. Professor Afork, Mr. Afork Tamuru. He valued what I said. I said professor, he kept quiet. I said Mr. He came. Thank you so much, bro. Thank you. Isin hindi ulfada sin sadino, Sister Saadanis, Boga Machunis, Dr. Tasfayanis ulfada, it does and deba. We do have few minutes to be on this very stage. By the way, I enjoyed the topic, despite my absence in the syndicates. I learned, I got something. At least a journalist should know something about everything. So I learned a lot from you guys. Now I would like to invite to the podium His Excellency Dr. Malkamo Abite, Deputy Director General of the Ethiopian Public Health Institute, for some messages to be addressed to the very participants. Thank you.
Good afternoon. Good afternoon. I can't hear you. Good afternoon. Yes, thank you so much. Excellencies, Dr. Tasfai and Sister Tigist, Deputy Oromiyaa Bureau Heads, and Mr. Lily, the chair of the Alibira Foundation, and the founder, invited guests and all protocols observed. It is really a pleasure for me to be part of this session today. I'll be very brief, as most of the discussions was fruitful and production that I've seen it. But I'll be very brief and I'll speak on some points. What I wanted to express here is what we are learning from the sessions like this. One thing is, where our expectation and what we want to do here is to have such kind of regions who has the capacity of having such kind of sessions. What we can do, one of the priorities that we are going to do is to strengthen the capacity of the regions. So having such kind of conferences by the ownership of the regions, the ownership of the research wing and the different departments is one of the commendable things that we're taking as an example for other regions to learn. And the second point is, unless partnership is here, we can't make it. So I saw there are different partners from universities, from international organizations, from foreign universities, from other regions, from partners. So this is one of the critical points that we are going to learn from this scientific conference, that everybody is coming at the front, everybody is coming on the table to deal on the priorities that we have, the problems that were on the table. And the third point that I'm very much impressed about is having the thematic area on this mental health activities, as it is saying enhancing mental health care and equity. One thing is to enhance the care, and the other is equity has to be at the center. We had a very nice conference for the past few days here at Skylight in parallel with this program, and I was one of the panelists there. And one of the main topics that we're dealing about is how we are going to make our primary health care system resilient. So resilience starts in the community, and resilience in the community. So to have a resilient community, one of the pillars has to be this mental health activities. So what we have learned from this session is these mental health activities has to be integrated with our overall interventions. It has to be one pillar. For this to be enhanced, what we are doing at EPHI is now, one, we have integrated it with our structures. So it is becoming one of the structures that we have. This mental health and psychosocial support structure is in our EPHI structure. The other thing is to having a proper data is one of the points which was raised by the summary. So for this data to be coming in a regular, in a routine way. So we are now making indicators to be a part of our surveillance reporting, our surveillance data, which we are going to announce in a short period of time. So that we are planning to integrate it in our already existing system. So this is a critical point which has been raised at a critical time. And we from APHI, we from the federal government, as it has been manifested, and that's been said by the commitment of the leaders by their opening speech yesterday. So we have the commitment to work in this line. And the final point I want to raise is the foundations like this Alibra Foundation, you have done a very nice job by sponsoring, by working closely with the regions. So this is appreciated, and this is going to be an example for others. So the charity for the people means reaching at the critical point, at the critical time. We really appreciate from our side as well. Thank you so much all. At last, I wanted to say that I'm very much happy, and from APHI, we all are committed to work with you. Thank you so much.
Thank you, Dr. Malcolm Abite, Deputy Director General of Ethiopia Public Health Institute, for that wonderful message in which he calls on the public for collaboration, togetherness. And the next message will be delivered by Her Excellency. As a matter of document, her name is Lily Marcos Birra. As a Mugasa name, Ilili Birra, founder and board chairperson of Alibira Foundation. Thank you.
I have myself mental issue. When I face a lot of people, I get nervous. So I have to apologize. I have to write it, or otherwise I will freeze. So anyway, Excellencies, Dr. Tesfaye, Deputy Heads, Dr. Tesfaye, Dr. Tigist, Dr. Malcolm, all protocol observed. Akan jirtan, bagarabin asin nugaye. I am speechless for how our event turned out. This is just the beginning. We created a big awareness and enthusiasm at home and abroad. We should be very proud. You should be very proud of yourselves. I am already receiving messages everywhere on how they can participate next time. Oromiyaa Health Bureau, we cannot thank you enough for taking Alibera Foundation, a very small, or a baby organization, under your wings. I truly believe that the sky is the limit going forward. I personally thank Professor Natsanet, Dr. Fayyaa, and the whole team for your patience, wisdom, and understanding and every step of the way. It wasn't easy, I understand. Whatever success we created today belongs to you. Thank you so much. You are an amazing group, so professional, dedicated, and sincere. You are all, to the Alibera Foundation team, you are already a family to me. Let us continue paving the way for more successful events like this. To the participants, we trust you all came from different places and everywhere. We trust in you to go out there and spread the word. Start to apply what you have learned, and do not be afraid to reach out when you face challenges. Our team, Alibera Foundation, is at your disposal. We look forward to work with you in the future. We cannot do it alone. Once again, on behalf of Alibera Foundation, I thank you all for coming. From now on, we are a big family. From now on, I will be honored if you call me Habu Lili, like everybody does. Bayay Galatoma Olfada.
Yeah, the name of that great person would always live on. Ali Birra, Ali Muhammad Musa, the legendary, the king, the actor, the composer, and polyglot, who, by the way, speaks 8 languages. Amazing. Thank you so much indeed, Lili Marcos Birra. And I would like to invite His Excellency Dr. Fayyaa Kabobo, Deputy Head of Oromiyaa Health Bureau, for closing remark. Put your hands together for him, please. Thank you.
Kam jirtu? Nagaa jirtu? Waan baay'ee jedhuun qabu. Dr. Malkaamuu fi haati keenya Lilli Birraa waan guddaa nuun jedhaniitiin jiru. Singalateeffachuuf qofaa fi iddoo kanatti kanan ba'e jechuudha. Your Excellency Dr. Malkaamuu Abbitee, Deputy General Director of Ethiopian Public Health Institute. Our mother, Lilli Birra, the chairperson of Ali Birra Foundation and the founder, all the team from Minnesota University, all panelists, all moderators, presenters, all our partners, especially those who have been engaged in as a collaborator for Ali Birra Foundation, and the only private organization which supports Oromiyaa Regional Health Bureau is Glando and the Mindri Company. Thank you for your contribution. Thank you for your time and the technical expertise, all of you. Galatoma, Ulfadha, waan isin nuuf gootan salphaa miti, waan guddaadha. Dhiyeessii dhiyaate keessatti waan guddaa barree jirra. Waan guddaa dhageenye jirra. Waan dhageenye kan ammoo maal goonaadha. This is not university or other forum, but it is an institution and implementers. Partially is a policy maker, but most of our job is implementing the idea, implementing the policy. So how can we implement the research output. How can we integrate to our policy? How do we integrate to the health system? Dhaabbileen fayyaa keenya maal asirraa baranne? Keessumaa hospitaalonni soddomni si waamne, yuunivarsiitiin torban as jirtan, akkuma kana geggeessitoonni magaalaa fi godinaa maal asirraa baranne? Maal asirraa fudhannee hojiirra oolchuu dandeenya? Biiroon fayyaa asirraa fudhatee maal hojiirra oolchuu danda'a? Qaawwa akkamii qabnaa? Qaawwa qabnu sana immoo maaliin duuchuu dandeenya? Yoo riisarchii dhiyeessuu ta'e, konferaansii yoo ta'e, yuunivarsiitiin baay'een akka kanatti hin dhiyeessu. Fooremii baay'een hin gaggeeffama, workshooppii gurguddaan hin gaggeeffama. Garuu hawaasa keenya bira ga'uudhaaf riisarchii outpuutii kanarraa maal fayyadamnaadha gaaffii guddaan. Warri sagantaarra jiru maal irraa fayyadameet gara hojiitti jijjiira kan jedhu assaayimentii keenya jechuudha. Poolisiidhaaf galtee ta'uu danda'a. Yeroo dhukkubsataa tokkoon tokkoo isaa yaallu galtee ta'uu danda'a. Ekspiriyaansii Minnesota Yuunivarsiitii irraa arganne tooppikii adda addaa irratti nu leenjisaa turan sun infraastiraakchariin keenya nu eeyyamuu dhiisuu danda'a. Garuu immoo compassionate taaneetoo lammii keenya dhukkubsataa tokkoon nu bira dhufu ittiin deeggaruu dandeenyaadha. Keessumaa warri godinaa magaalaa fi hospitaala irraa dhuftan yoo inni kun hojiirra ooluu danda'e, yoo inni kun gara hojiitti jijjiirame gammachuun keenya guddaadha jechuudha. Kaayyoon konferaansii kanaas galma ga'e jechuudha. Kaayyoon Alii Birraa Faawundeeshiniis galma ga'e jechuudha. Oromoof qabsaa'aa turanii, Oromoof sirbaa turanii, namni lama namni sadii faawundeeshinii kana keessa jiraatu iyyuu malee umurii isaanii guutuu kan dabarsan, kan qabsaa'an, Oromoon akka baratu, Oromoon akka tokko ta'u, Oromoon akka biyya isaa jaalatu, akka biyya isaa ijaaru, akka duubatti nafne, sirna isaa akka qabatu, aadaa isaatiin akka guddatu, uummata nu barsiisan, uummata fuulduratti ceesisan, nu tarkaanfachiisan jechuudha. Har'a namoonni lama sadii geggeessuu danda'u. Kanaaf mul'ata isaan qabatanii turan kana akkamitti dhalootatti dabarsinaa, fayyaa keessatti maal irraa fudhannaa waan guddaadha jechuudha. Isaanis waa hunda irratti miti kan hojjetan. Dargaggeeyyiin keenya yeroo ammaa suusiin qabamanii rakkoo adda addaa keessa jiran, araada adda addaa keessa jiran akkamiin keessaa baasuu dandeenya? Kanaaf godinni keenya, magaalli, hospitaalonni keenya, yuunivarsiitiin naannoo Oromiyaa keessa jiru immoo dhugumayyuu addikshiniidhaan uummata keenya rakkataa jiru, dargaggeeyyii rakkataa jiru, hojii dhabaa rakkataa jiru, akkamitti gara jireenya nagaatti finna? Gara sammuu qajeelaatti finna kan jennu waan baay'ee irraa arganne jennee yaanna. Keessumaa kaleessa paanal diskeshinii gubbaa irratti waan guddaa irraa argaa turre. Substance addiction caatii irratti nuti jennu caala qorichootaan illee namni meeqa miidhamaa akka ture ragaadhaan nutti agarsiisaa turanii jechuudha. Paanal diskeshinii kaleessa irratti. Kanaaf godinoonni keenyaaf magaalonni keenya, hospitaalonni keenya keessumaa aanaa warri deeggarru, ganda warri deeggarru akkamitti dargaggoota keenya achi keessaa baasna kan jedhu yoo hojiirra oolchuu dandeenye, yoo jabeessine saayikaatirii OPD moggaatti ba'eetoo jiru yookiin OPD eeggatee hojjetu OPD gaarii banuufi yoo dandeenye, qoricha inni barbaadu bituufi yoo dandeenye, gaayinlaayiniidhaan akka inni hojjetu leenjii kennuufi yoo dandeenye, onnachiisuu yoo dandeenye, riisarchiin keenya kun galma ga'ee jechuu dandeenya jechuudha. Health carein keenya hin guddisna, enhancing mental health jennee kan qabanne, keerii qabanne kana universal health coverage dhugoomsina. Fuuldura taammatu kan jennu kuni yoo asii galleetoo kana gochuu dandeenya jechuudha. Kanaaf akka biiroo fayyaatti ergaan koo inni guddaan keessumaa hospitaalaa fi godina magaalaa warri dhuftanii gara hojiitti jijjiirtanii tajaajilli kun banamuu yoo danda'e gammachuu keenya waan ta'eef yoo kana nu gootan galma geenya jennaa. Yoo kun hojiirra hin oolle ta'e immoo walgahii akkasumaanii ta'a. Sababii ta'eef ergaa keenya akka qabattan sin jedha. Kanatti dabaluun warri nu deeggartan silas dubbadheen jira, Gilaandoo, Mindirii, akkuma kana immoo Alii Birraa bukkee warri dhaabbattan akka Biraayiteen maqaa dhaabbilee baay'eetu jira. Siinqee Baank, Oromiyaa Baank, Raamiis Baank, dhaabbileen gara biroos baay'eetu jira kan isaan deeggaran. Bukleetii keenya, abstiraaktii keenya irraa ilaaluu dandeessu. Bukkee dhaabbattanii nuun fayyaa irra deeggaruu duwwaa odoo hin taane boruuf taanillee hojii dhaabbanni Alii Birraa Faawundeeshinii deeggaru keessatti akka deeggartan ergaa koo dabarsaa. Qe'ee nagaatti galaa, Rabbiin sin faana haa ta'u, ulfaadhaa, galatoomaan siniin jedha.
Dr. Tesfaye Kebebo, I'm going to say, Doctor, come in here. Doctor, you stay here. And now others in front here, join him for a group photo program, please. Come on, join the front ones. Yeah, the Minnesota guys, yeah, our guests. And we'll be our diplomats even in Minnesota and the United States of America. Photographers, come closer. Yeah, don't include me anyway. Don't include me anyway. Thank you so much. And others would also join, by the way. Surah kana, imbaina, walin kadim te, yadanno wantatif. Yadanno ta wantatif. Photographer, guests of honor kasir no butunut, kafit lafit. Warri kuwan gubba olba, duban olba. And at the same time, I should thank singer Elemo Ali and singer Mukhtar Adero. They are among us. Thank you so much. And Oben, Voice for the People, which broadcasts in 20 languages, was here with us for 2 days. And that is a special thing that I should talk about Oben. And I'm one of this giant media house. Thank you so much, guys. Fayyaa isin jaalanna hamtu isin argini gufuu isin dhayini kolfa. Smiling face is important now. Thank you so much indeed. Thank you so much indeed. Bye-bye.